Hi, my name is Chelsea Binder. I'm a student nurse at Cedar Crest College in Allentown, Pennsylvania, and today I will be discussing my research on music therapy and anxiety levels, which yields my PICO question of in adult hospitalized patients ages 18 to 65 years old. Does the use of music therapy intervention compared to pharmacological intervention reduce anxiety? The significance of the problem being that anxiety is very prevalent worldwide, whether in a hospital or not. Especially in the hospital, patients' anxiety levels can be increased due to their health concerns and why they are there. It is the nurse's responsibility to assess these patients, and they can look for physiological signs and symptoms such as increased blood pressure, heart rate, respiratory rate, or psychological symptoms that the patient is stating to them that they are feeling very anxious right now. You could be short of breath also. So it's solely the nurse's responsibility to assess these patients, and as nurses, we want to help them get back to their original state and to not be so anxious in the hospital. With that, we can use music therapy intervention to do so. So the process for my literature search was to first look at the CINAHL database. I plugged in the keywords of nursing, music therapy, and hospital, and yielded 26 results after putting in geography of the United States of America, full-length text, and the certain date parameters of 2013 to 2019. Out of the 26 results, I went through and read the titles, also the abstracts, to find what best fit with my PICO question. I then also used Google Scholar as a database. With them, I entered a phrase, just put in the keywords all together, said nursing, music therapy, anxiety in hospital, and it yielded thousands of results. So from these thousands of results, I brought it down from using the date parameters again of 2013 to 2019. From then on, I just went through to see what I could get as a full text link and looked at titles, abstracts, and it yielded me with a total of 3 nursing research articles that I have used in my research here. The first was from Bratt, DeLeo, and Potvin in 2013. They looked at anxiety levels of patients with coronary heart disease and how music intervention could help them with their anxiety. The results yielded that the patients did have a decreased anxiety level after the intervention was performed. The second article that I used was Eckhouse et al. In 2014, and the researchers were looking at patients who were in the hospital with orthopedic or cancer treatments and how music therapy can help them with their anxiety levels. It was shown a decrease in anxiety in all of the patients after the intervention. And lastly, I had a research article from Magani et al. In 2017. Magani et al. Focused on critically ill patients. So with these patients that are critically ill, they focused on the nurse's perspective also in critical care nursing and how music intervention has helped them take care of their patients. And it was shown a decrease in anxiety levels for all of the patients that had the music intervention, and the nurses liked the intervention and would definitely use it again. It was stated some recommendations for practice are that to have more of a set rate of the frequency of the music and what type of music is being used. Also to have the nurses be trained on the music therapy so that they can utilize it for their patients. And studies in the future should focus on different patient populations. So in conclusion, music therapy is proven to reduce anxiety levels in patients from 18 to 65 with different disorders. It is a very cost-effective and available treatment to many with anxiety you don't have to have a lot of money to afford it. You can play music anywhere, the radio, your cell phone. It doesn't have to be a live performance. Also, music therapy can be used in different settings, from hospitals to homes to rehab homes, anywhere in between. And many can benefit from it and its effects on anxiety. Thank you.